So we're good? Okay, good afternoon, everyone. I am KP George, Fort Bend County Judge, and thank you for coming. I know that it's a short notice. You all came here to talk about an important thing. And we continue to open up our economy, going back to normal life. That's what we thought. And we see a spike in positive cases on COVID and also hospitalization. And also we have noticed a rapid spread of COVID-19. And obviously, maybe we are tired of COVID, but it looks like COVID is not tired of us. It is around here. Recently in Fort Bend County, we actually passed a dark milestone, surpassing 50 deaths and also 3,172 new cases, confirmed cases. And that is actually comparing last couple of weeks. It is an exponential growth, and it is kind of concerned us. And obviously, we need to do something, and then that's why we are deciding to do something about it. And so, one of the things is we always looked at our local leaders and stakeholders, and also our community members. That's important to us. We have been approached by some of the major retailers like Kroger, H-E-B, and other retailers, and also our healthcare system, the Methodist system, and others in our county, and they see that there is a need of having some kind of a mask ordinance where they would be able to enforce when their customers and staff come to work and come to get their service in their places of business. And also we have noticed percentage of confirmed cases in Fort Bend County. Percentage of confirmed cases in Fort Bend County jumped from 4.8% to 9% last few weeks. So that means it's showing a clear indication of number of cases continue to rise in Fort Bend County. As we see that, and like I said, you know, our community members and our community leaders are important to us. That's why we are listening to our business community. We are listening to our healthcare system, and more importantly, we always believed in and we always trust our citizens. That's the reason why maybe 40 plus hours ago we put a survey out there and asked our residents to respond to a survey and see what they think about, you know, a mask ordinance not directly enforceable to our citizens, but we wanted to see what they think about it, and we have around 17,500 residents responded to it. Out of that, a whopping 77.5% of the respondents said they are in favor of it. So that is the very reason why we are moving forward, listening to our business community, listening to our community leaders, and as mentioned, also faith leaders. All our stakeholders believe it's time for us to do something because this issue is kind of spiraling out of control. And so with all that, actually, I am signing I signed an order ordering an order effective midnight tomorrow, which is June 25th. All commercial retail businesses physically located in Fort Bend County to require all their employees and their customers to wear face mask covering while they are inside the premise of the business. Every business must post a visible signage at the entrance of their business informing customers that everyone inside the store must wear some kind of face covering. And as we all talk about, it is about helping our community recover, helping our community to combat this unprecedented time, COVID-19. And one of the concerns we continue to hear from our businesses where they're concerned about the safety of their employees. And that is also important to us, because if there is no employees, they cannot serve their customers. And so we want to make sure this order is in place. And with that, I definitely wanted to invite some of our leaders in Fort Bend County. And I will start with our Health and Human Services Director, Dr. Jacqueline Minter, to give an update. Dr. Minter?
Thank you, Judge George, and good afternoon. In this unprecedented season of a worldwide pandemic, each of us, thank you, each of us has been forced to live in an environment of relative uncertainty and take actions based on incomplete and evolving information. Prior to the stay-at-home order that was issued in our county in late March, we were witnessing a rapid increase in cases of COVID-19. Our regional healthcare system was not prepared to appropriately care for the numerous people who might need a high level of care if we did not act swiftly to slow the spread of COVID-19 transmission. Fort Bend County residents complied with this order, and we saw the benefits of our patients in the decrease in growth of disease and death. This decrease did not come without a cost. We suffered economically, socially, and mentally, and those costs are not to be ignored, and they are still being felt. The desire to minimize the additional devastating impact of COVID-19 is absolutely understandable. Because this disease is transmitted by close contact, we anticipated that there would be an increase in cases as our cities and our state reopened. The level of the increase was dependent on many factors that could only be estimated. So we can't estimate or can't anticipate every situation which might cause an increase in disease transmission. And we're continuing to learn about the behavior of this virus, and there's much that may change. But what we do know is that the virus spreads rapidly when people are within close contact through droplets that come from coughing, from sneezing, from talking, from laughing, from singing. And we do know that avoiding large and mass gatherings, wearing face coverings when distancing is not possible, staying home when you're ill, and washing your hands frequently will all reduce the spread of COVID-19. We have watched in recent weeks as the numbers of younger people with disease has risen, and some of these have resulted in hospitalizations, and it's greatly impacting our healthcare system. Many businesses that were beginning to open have had to close again due to the numbers of workplace infections and exposures. It's time again to institute measures that will protect our community's health and well-being. It's no secret that there are consequences to every action we take. Some of these consequences are pleasant and positive, and others are not. We ask for your patient participation with measures to again ensure that we can slow the disease transmission in our region. Thank you.
Thank you, Dr. Minter. And I have always, as I have always said, our decisions will be always been based on data, science, and
You've been listening to the latest from Fort Bend County, where we have learned the number of cases continue to rise. So Fort Bend County Judge, KP George, who is speaking right there, has issued an order effective at midnight tomorrow for commercial and retail businesses, requiring all employees and customers to wear a face mask covering while inside the business. They must post a sign informing customers of the order. This decision was made after the county conducted a survey of residents about a mask ordinance. Around 17,500 residents participated. 77.5% of the people who took part were in favor of a mask ordinance, hence where we are today. And right now, you can continue to watch this update from Fort Bend County on KHOU.com. We'll be right back with the rest of the day's news after this.
Whether you live in Missouri City,
to protect you, and really it's not that uncomfortable if you find the right one that fits appropriately. So maybe If you find the right one, it won't be so bad. But, you know, the fear of catching the virus or spreading the virus should be the basis for your decision to wear a mask. So help us keep the community safe. And as I've said before, this should not be a law enforcement matter. You should take responsibility for protecting your own health and protecting the health of others around you. Thank you.
Thank you, Mr. Middleton. I always mention this, all these ordinances when we issue, I always said this, it is not to punish our citizens. It is not to punish our businesses. That's not the purpose. We are trying to put a standard order in place so that we all can be safe. And at this point, I will invite our County Attorney, Roy Cordes, to talk about the order. Roy?
Thank you, Judge, and good afternoon. And as Mr. Middleton was saying, we all can find a mask that will work. In my case, I also wear glasses, so sometimes my glasses fog up. But it's worth putting up with that to be able to wear a mask and provide protection to others. It's a minor inconvenience, and I think we can all do that. Brian had some wonderful words about what we all believe in. The county attorney's office worked with the judge's office and followed those general guidelines in developing the judge's order that he signed with the declaration of emergency to put that back in place as well. And as the judge indicated, all commercial entities with a physical location in Fort Bend County providing goods and services directly to the public. Now, this will not include churches or other places of worship. Must require that all employees or visitors to their businesses, premises, or other facilities wear mask coverings when in an area or performing an activity which will necessarily involve close contact or proximity to coworkers or the public, which is a way of saying anytime you're within 6 feet, you need to be wearing a mask. It holds businesses, the commercial entities, accountable for that, not the individual, not the public, but the businesses. Failure of the commercial entity to comply with the requirements of this order may result in a fine not to exceed $500 for each violation. The decision was made not to use the $1,000 that could be allowed, but to reduce that potential fine in half for each violation. Much like the other orders, there are times when it will not apply. Face coverings are not required to be worn in either of the following circumstances: when you're outside facilities, when doing so poses a greater mental or physical health, safety, or security risk, while pumping gas or operating outdoor equipment, while in a building or activity that requires security surveillance or screening, for example, banks. I think we all expect that. And then when consuming food and drink. And something I think unique to our order, the judge's request, we put in language that all commercial entities are encouraged, as their financial limitations will allow, to provide face coverings, including masks, to their visitors who are unable to provide their own. We're trying to be sensitive to all needs, not only the business, but those of our citizens within Fort Bend County. Judge.
Thank you, Roy. And as I mentioned, this is again not a punishment. We are not looking to punish our citizens, and we are not looking to punish our businesses. It is simply we wanted to be safe. And at this point, I wanted to invite our emergency management coordinator, Mark Flathouse, and also Mark is also a fire marshal. Mark, please go ahead.
Good evening. A couple of things real quick to follow up with what's been discussed so far from the judge is the Emergency Operations Center will be activated at a level to assist and help with this order. The key thing is communication. Communication between the jurisdictions, to the citizens, to the businesses, and to everybody that needs to know and understand the importance of this order. So our purpose and our responsibility over the next week to 2 weeks is to make sure to not only take the message from the judge's office, but also make sure that the jurisdictions understand it, and we're here to help and answer those questions, along with assisting with HHS, with testing sites, and any type of operational needs from them. So with that, please adhere to what the judge is trying to say with this message, and we're here to help and assist with it. Thank you.
Thank you, Mark. I just wanted to, at this point, I just wanted to invite one of our community partners, Kroger Corporate Affairs Manager, Clara Campbell. Please come forward.
Thank you, Judge. So at Kroger, the health and safety of our customers, associates, and communities is always a first priority. Since the emergence of COVID-19, we have been closely monitoring the impact on the safety of our communities and on our store teams. In Fort Bend County, we will require that all customers and associates wear a mask or face covering while in our stores, in an effort to provide a safe environment for everyone who visits us. As we experience a surge in positive cases across Fort Bend, it's critical that we do our part to stop the spread by wearing a mask. You're not only protecting yourself, but you're protecting those around you, including children, our senior community, and those who are immunocompromised. Signage will be placed at our entryways as a friendly reminder for all customers entering our stores, as well as in-store audio messaging. If a customer forgets their mask or face covering, no need to worry. We have disposable and reusable masks available for customers at our front end. We've partnered with several counties across Houston to set up a number of free drive-through testing sites staffed by our Kroger pharmacists and serving our communities. It's also important that we, as a local grocer, support other businesses and share what we are learning and where we can improve. We have learned a lot from others by collaborating and by sharing valuable insights on how to reopen safely and how to stop the spread. In the same spirit, we will continue to share what we have learned and our best practices through our partnerships with other businesses and government officials, including insights from our COVID-19 task force and our data-driven response in our Kroger Blueprint, which is accessible by anyone online at krogerco.com, and I have a number of copies here today if you would like to see one. We strive to make decisions that balance the safety of our associates with our commitments to our customers and communities, and above all else, we'll be there for our communities when they need us most. So I just want to say thank you to all of our customers and all of our associates for their support as we work together to slow the spread and keep our communities safe. Thank you.
Thank you. Thank you, Ms. Campbell. And at this point, I will invite President of the Fort Bend Medical Society, Dr. Majid Bassett. Did I say it right?
Yes. Judge George, thank you for inviting us. I'm Majid Bassett. I'm the president of the Fort Bend Medical Society. I also represent the Texas Medical Association. And as our teammate president, Dr. Feit, had echoed what Governor Abbott and now Judge George had said, it's so important to wash your hands and to wear a mask. And why? I work in the hospital, and I see every day our numbers growing. And it's getting to a point where it's reminiscent of our first peak. And why is that important? Because we have only so many beds, and these COVID patients stay in the hospital for days, if not weeks, and they get very sick, and they need a lot of resources. And we ourselves can get sick as well, our doctors, our nurses, everybody in the hospital and in the clinics. So it's important that you don't get sick so we don't get sick. What else? What else can we do? So you as a community member, you should listen to Judge George, because by preventing the spread, you prevent people from getting infected. We're at the end of the line. We take care of the people that are very sick. We don't take care of the people that are at home recuperating on their own. And when the hospital gets full, who else is going to take care of you? So it's so important that everyone listen to this, be practical, not just think of yourself, but think of everybody else that is impacted by this virus. This virus is here, and it's going to spread, but you and only you can help to minimize that spread. So thank you.
Is Dr. Okay, you just. Okay, thank you, Doctor. And I just wanted to read a statement from our Interfaith leaders. As faith leaders in Fort Bend County responsible for the spiritual well-being of our congregants, we support the important recommendations of the CEOs at Memorial Hermann and Methodists in Fort Bend County calling for increased usage of facial covering. These are simple, common sense measures aimed to safeguard the health and well-being of all our citizens, and may God protect us all from harm and deliver us to a safety soon. Signed and supported by 42 faith leaders in Fort Bend County. With that, we will conclude this discussion here. If you have any question, we are more than happy to answer. Yes, sir.
you have the daily numbers, because we were not able to explain why there was a sudden spike,
Yeah.
or the results were because of test taken several days ago.
Yeah.
How would you attribute to the positivity rate?
Yeah. If you go to fbchealth.org, we have a dashboard. And if you hit our daily numbers, and there is a historical data available. Yeah.
The state has a positivity rate.
Yeah.
Which talks about number of tests done
Yeah.
plus number of infections.
Yeah. And I will invite Dr. Minter to answer that question. Please go ahead.
It has gone up to 9% yesterday.
Yeah.
But we don't have a similar thing on our county side.
Okay.
First time I heard from you that you have that number, that's why I'm asking.
So you would like the positivity rate on the local site?
Yes.
Yes, so you're right. We don't have that on our site right now. We certainly can work to put that on the hub. But our numbers as well have gone up, just as the judge says, and as I do report to the local officials, that it has gone up. So we were looking at 2 to 3% in early May, and we're looking now at 9 to 10% right now in Fort Bend County of the positivity rate. And that's of just the tests at our sites, because those are the ones that we have control over. Yes.
To what do you attribute that increase, that rise?
Yeah. We attribute that to increasing disease in the community. When you look at the TMC website and their data, what they show is that on May 1st, when we started opening up, we got to look at the 2 weeks after that opening. And we still, in this region, stayed around 3% of positivity. At the opening of, I think, the second phase of opening, May 18th, we started to notice more of a rise. We know that this disease needs people, and it needs contact. And so the more that we're out and we're about, that is going to cause an increase in disease transmission. That's just what is going to happen the way this virus connects with other people. So that's what we attribute it to. And also to the fact that we've had holidays, we've had more mass gatherings, people are in closer contact. We do know that large and mass gatherings will increase the spread and the transmission of COVID-19.
We always talk about regional. I'm talking about in Fort Bend County of 3,100 cases.
Sure.
Have you ever found a particular source of gathering more than 10 people?
Right.
Have you established a link?
So there's not a link between a specific gathering that we have found now. That doesn't mean that we won't see one later as we continue to investigate. It takes a while to be able to kind of pull out that data, but in our county, no. We have not seen a specific link that tells us for sure this, it happened here and this number of cases occurred.
Dr. Minter, why do we see 172 cases today and 50 the next? What's that about?
Yeah, that's a really good question. So it's a reporting number. And so when we get the data, it can cover cases that may have occurred 4 weeks ago, as well as cases that may have occurred a couple of days ago. So we get our data kind of dumped to us from day to day. Sometimes we'll get a few cases, sometimes we'll get more. But they do represent more than just the one day. It's just a reporting day.
So they're trickling in and sometimes they gush in.
Exactly. Thank you.
So how can you rely on this uncertain data? You cannot say it is continuously growing. And also hospital numbers, you had 24, now 20. Maximum it was 34, 35 a few weeks ago.
So those are excellent questions. It's about data reporting. And when we're reporting out data, in the past we would report out data in a week. Now we're in a totally different environment where people want data every moment, every second. It takes a while to actually parse through that data and determine where it's coming from. Your question about how can we rely on it, once it comes in, we report what we've gotten that day. Then we take that data and we put it into either test date, onset of symptom date, and then when we go through daily counts, we'll be able to show you better what happened and where.
So will you be able to do that now?
We absolutely will, and we'll get those up on our hub.
Your Honor, who's enforcing this order? Who's going to be marching in these stores, Target, Kroger, and making sure that everybody's covered up? Will that be the Emergency Management Office, the County Attorney's Office, or the District Attorney's Office, or the local police, the sheriff?
Yeah, that's a good question. First of all, I hope each and every one of our businesses, the same way we had stay-at-home Save Life order, And our citizens, most part, was very responsible, in my opinion. That's the very reason why we did not do a mask order, even though our neighboring county did. We did not do one in here because I believe in our citizens. And at this point, like I've said before, any of this ordinance we are not signing simply because we could punish our businesses or our that is not the intention here. And I'm hoping and I am almost confident our businesses are going to be responsible to follow through on it. But then there is local jurisdictions we work with, and maybe we can I can invite Mark Flathouse to give a little bit shed a little light on it, because there are local jurisdiction cities and others we work with, so they would be part of this discussion.
Over the next 24 hours before it's implemented tomorrow night, there's multiple meetings that will take place with the jurisdictions to help understand what the order is and also the enforcement of it. So with that being said, we're still working through the avenues of how the enforcement will take place, and more information of that will be provided hopefully in the next 24 hours.
Mark, many of my readers, many, believe this is a hoax, believe it's fake news, fake news. And they don't see the reason for wearing masks. They reject it outright. What's going to stop them from going in the store and saying, no, you're not going to make me wear a mask to Kroger here. No, we're not going to do it. What happens at that point when someone says, no, I'm not going to wear a mask for you? I don't believe in that.
So those are the things that we need to make sure that we get the communication. Communication. So when you're dealing with emergency management, let's take a hurricane. The best information that comes out when it comes to a disaster or anything along those lines is communication. This goes the same exact situation. And as long as we educate the public that the purposes of what Dr. Minter and the judge have said about the spread of this disease and making sure that we maintain the businesses open. The kicker is that if we don't control this, we could go back to the way it was or anything along those lines. And we want to make sure that we adhere to what the governor and the judge and also Dr. Minter have to say along these lines. And we need to make sure that the public understands the reason why these businesses need to have masks on. The last tier of it is basically along the line, the enforcement action, and we'll be working over that over the next 24 hours.
And also, I just wanted to say this. Obviously, we already had a jurisdictional call this afternoon, and we will be continuing to work with. And also, this order is a result of a request came from many of our retailers in this area, and that's the reason why we are doing it. So they want this order so that they could tell their customers there is a local order in place, we are just implementing it. And so they want this, that's what we are doing. And at this point, I will ask Dr. You wanted to add something to it, because why it is part of education too, and please go ahead.
So, I think it's very important for people to realize that masks work. There's no doubt, there's plenty of studies, scientific studies, to show that even speaking, coughing, sneezing, singing, all those things can spread the virus, even if you're not symptomatic, even if you don't have fever, even if you don't have any classic symptoms of a viral disease. You can still be spreading, and then, oh my gosh, the next day you start to have these symptoms, and now you've infected all those people the day before with the virus, and you didn't even know it. And so it's important to realize that this is a highly infectious disease, and what we call asymptomatic spread is a very dangerous problem. And once you realize you have the virus, it's too late. Masks are a very, very simple way. Washing your hands, very, very simple way. I can tell you that I've washed my hands more in the last 2 months than I've washed in the last 2 years. And why? Because it kills the virus. What do masks do? They protect people around you. You want to protect those people that could get sick, could die, could end up in the hospital. You don't want to do that for them. Thank you.
Thank you. And I will hold on 1 second. I will move on here. Yeah, please. Yeah.
To answer your question about law enforcement, be mindful, when we had the stay-at-home orders, we didn't have any of these confrontations. I think by and large people will do the right thing and they will wear the mask. I've said it before, it would be a sad state of affairs that law enforcement has to force somebody to do what's right and do what's in their best interest. So I have more faith in my community. I don't think we're going to have those confrontations.
The onus is on the business. They have to ensure that the customers
And we,
if a customer refuses, though you are giving free,
yeah. If the customer refuses, they have the freedom to walk away. They don't have to let them in. It's a private property.
so that
Right.
the business can
Yeah.
deny entry to a customer.
Right. And also the whole idea is, you know, customers have to wear a shirt maybe in some cases, or they have to wear a pair of shoes. They won't let you in otherwise. So the same thing. So the retailers asked us, we like to have this freedom to tell people, hey, we are trying to enforce a local ordinance. And that's why we are doing this, because like I said, we are not looking to punish. We are not looking to, fine citizens. It is going to be, we are going to give it that power to the retailers so that they could say, hey, if you don't want to wear a mask, we are not going to serve you. So that's, any questions, sir?
Retailers are facing fines. What can a business owner expect if they have customers, they're caught with customers without masks?
Say that again?
What can a retailer expect if they're caught with customers shopping without masks? What's the process that will happen to them?
Probably, Brian, you want to?
Citation, be cited for.
Yeah, go ahead.
Yeah, possibility would be citation if it's brought to the attention of law enforcement. The possibility is a citation. For each case, yes.
Is that something that they would call 911 for as a business owner, or how would they?
No, they actually refuse to serve that customer.
Okay.
We cannot because Governor Abbott said you cannot issue a citation to, or you cannot punish a citizen for not wearing masks. Governor Abbott said it very clearly. So that means the businesses are saying we'd like to have the power to say, hey, because of this, we are not going to serve you. They could go somewhere else. But the businesses like to have that power. Or they could say we are trying to enforce our local ordinance. And that's the purpose of this order.
Yeah, so if a business, like you were saying, was in violation and that was discovered, then it will be handled by a citation.
Yeah, the fine is going to go to the businesses, not the individual refusing to wear. Yeah. Any other questions? Yeah.
There were 23 people in hospital beds I read this morning, right? 23? 20? Okay, so we got a lot of capacity, right?
So that's maybe
So
Dr. Minter?
Please, come on. Dramatic for the
So I've been watching the number of bed capacity in the hospitals, and I can tell you for a fact that if you look overall, especially in the Texas Medical Center, the numbers are growing significantly. Remember, we're also taking care of heart attacks, strokes, we're doing surgeries, and that all plays into the capacity. So the hospitals are full, and the number of patients that have COVID are going up. Where are we supposed to put these patients?
Are we getting them over here? You bring them from Houston over to Fort Bend County?
We're trying. We are trying to handle our own patients. The medical center is handling the patients that are coming there and the ones that are sick that need to be transferred to the medical center for higher level of care. But in several instances, there's no beds to put these patients.
Locally, in Fort Bend County, there's so many hospitals, only at 23.
So again, you have to realize that we're also taking care of other patients, right? And so the bed capacity is based not just on the number of COVID patients, but also other patients. You fall and break your hip, you have a stroke, you need to have a bed to be taken care of. And so if you have a COVID patient that comes in as well, and there are no beds, what are we supposed to do? And so, again, prevention is the key. And if people don't listen, we're going to overwhelm our healthcare system, and then we're going to go back to having to quarantine again. And so we don't want to go there. So please.
Also, if you scare people, they won't listen, doctor. This is not the case. The hospital number, we always quote PNC and Fort Bend County people. It cannot be only we go by Houston data. If we show the same case in Fort Bend, it is more convincing. That's what we have been trying for weeks.
Yeah, but again, the hospitals.
Houston regional data, and
yes,
we have to follow.
I can tell you for a fact, running in the hospital every day, the hospitals are full. There's a patient in almost every bed. Okay, those patients belong there because they're sick, and if the need goes up, we don't have a way to make more beds.
So, thank you. Yeah.
This time of year, are you used to seeing this many of the hospital beds taken up?
No.
Can you walk up to the mic and kind of explain?
Yeah. So normally in the winter and the fall, we have more beds that are needed for the flu and other problems. But this time of year, because maybe because of quarantining, more patients came as a surge with heart failure, with stroke, with other problems. And so normally we don't see this many patients. And so again, another reason to make sure that we prevent further spread and further disease is because our hospitals are so full.
Thank you for coming, and greatly appreciate it. And let's all get back to our business, normal businesses. And I appreciate you all being here. Thank you very much. Thank you.